My name is Dr. Caspian Choba. I'm the Regional Director with the Elizabeth Glaser Pediatric AIDS Foundation. Based in Eswatini, Mbabane, Eswatini, formerly Swaziland, but I support a number of countries under ECPAF. I'm not going to give remarks, I'm not going to give a speech. I think my superiors from USAID are going to do that. Mine is just to greet you and maybe briefly talk about who we are as ECPAF and appreciate all the stakeholders that we work with. And then I think I'll ask USAID to make most of the remarks as we work closely and under them as well. So the Elizabeth Glaser Pediatric AIDS Foundation is an international NGO. Our headquarters is in Washington, D.C., in the United States of America. We operate mostly in Africa, Southern Africa, Eastern Africa, Western Africa. We also do support programs in Asia as well. Our main mission is to ensure that no child lives or has HIV or AIDS. I think that's what we are trying to work on. Until no child has HIV, until no child has AIDS. We come from, we're formed because of the mother's first love. Elizabeth Glaser was a woman based in the US. She was a mother, she lived with HIV, and unfortunately she transmitted HIV to two of her children unknowingly back in the 80s. One of the child unfortunately passed away. One of them is still alive even today. She formed the organization just to ensure that we work together with the various governments and ensure that our children are not going to be having HIV. If they have HIV, they don't proceed to have AIDS, can live longer, especially with the treatment that we are currently having. So I just want to appreciate all of you. I want to start by appreciating the government of Tanzania for the great work that you are doing in this country. We work closely with the government. We support the government in everything that we do. I've seen fantastic work that is being done. We really appreciate the leadership, acting regional commissioner of the government of the Kingdom of Tanzania. I'm used to the Kingdom of Eswatini, so if you hear me say kingdom, I come from a kingdom. So government of Tanzania, we really appreciate your leadership, your guidance in the work that we're currently doing. I was just talking to my colleague here, how I truly appreciate your infrastructure. It's amazing. You have wonderful infrastructure, something that I have not seen in several countries. And yesterday I had the best rice in my life, Magugu rice. I'm going to be really marketing that rice, and I'll make sure that I take 2 kgs back to Eswatini. So you have an amazing you have an amazing country, you have an amazing infrastructure, and we really appreciate the work and the partnership that we have with the government of Tanzania. Secondly, allow me to appreciate our donor, USAID. We truly appreciate almost all the work that we do here in Tanzania is through the funding from USAID. Madam Ain Moses, we really want to appreciate you. Thank you so much for partnering with us. Thank you so much for allowing us to work closely with you. We don't take it for granted. And not only in Tanzania, but in several countries where we are working as ECPAF, USAID is our major donor. So most of the work that you see us doing is through the funding from USAID and the United States government. So we really appreciate them as well. I also want to appreciate our ECPAF team in Tanzania, led by Madam Jitihada, who are doing an amazing work in this country as well. But specifically, allow me to appreciate the team here in Manyara, led by Dr. Alfaxat. Really an amazing job that you are doing. These are the people that are on the ground doing all the activities that you are seeing, and we truly appreciate them as well. So thank you for having me. I hope I'll be back again here in Tanzania one of these days, and I'll speak fluent Swahili one of these days. So without further ado, let me allow Madam M to come from USAID and then make the remarks. Like I said, she will speak, we work under them, we get support from them. Thank you so much. Asante.
So it is a great honor and immense pleasure to participate in the launch of this fabulous one-stop center to address gender-based violence and violence against children here in Manyara. I do bring you greetings from the U.S. Ambassador to Tanzania, Michael Battle, and the USAID Tanzania Mission Director, Craig Hart. I do want to thank the government of Tanzania, Manyara's regional leadership, including the regional commissioner, regional administrative secretary, and regional medical officer, for inviting me to the launch of this one-stop center, as well as the staff of the USAID Afya Yangu project, who are supporting these efforts on behalf of USAID. As has just been mentioned, none of this could have happened without all of those I've mentioned. Gender-based violence and violence against children have far-reaching traumatic impact on people and communities, and lifelong health consequences for survivors. They're major public health issues that contribute to substantial morbidity and mortality, especially for women and children. The World Health Organization's global estimates are frankly quite tragic. 1 in 3 women globally has experienced physical and or sexual violence in their lifetime. Up to 1 billion children, that's a number I can't even conceive, have experienced physical, sexual, or psychological violence just in the past year. 1 in 4 suffer physical abuse, and 1 in 5 girls, that's 20%, are sexually abused at least once in her lifetime. And looking around at a crowd like this, you realize the impact of those numbers, if 1 in 5 of us has been. In Tanzania, or beyond these numbers, GBV and violence against children impact communities, development, and public health, of course. In Tanzania, 40% of all women aged 15 to 49 have experienced physical violence, while 17% have experienced sexual violence. And that's really kind of reflective of the global numbers as well. An alarming rate of gender-based violence has been reported here in Manyara, especially against women and children. The launch of this one-stop center at this time is therefore really timely and important, and hopefully will serve as an example for other regions to follow suit and open theirs as well. By providing comprehensive GBV care and linkage to HIV care for survivors, this center does not only meet an urgent need, but really gets to hopefully get to the root of the cause. The U.S. government has been at the forefront of working alongside the Tanzanian government to tackle major public health challenges. In 2024, the U.S. government funded the Welfare and Health of Youth and Children Survey, and will be working with relevant ministries and partners to address this persistent problem in accordance with the findings. Currently, USAID has been providing support to nearly 5,000 GBV survivors annually in the 11 USAID-supported regions here in Tanzania. We do know that it will be difficult to achieve our development objectives if gender-based violence and violence against children are not addressed. We have a lot of other public health and other programs at USAID, and this is kind of an underlying problem that impacts a lot of those other ones as well, like our maternal child health programs and our youth and education programs. So I am happy to inform you that in August this year, USAID convened an Implementing Partners Gender Integration Workshop to deepen understanding of gender equality and gender integration approaches in Tanzania. So USAID will use the synthesized information to continue preventing and responding to GBV and violence against children in Tanzania. And this one-stop center, launched today in Manyara, is critical to this effort and is part of broader incremental steps to advance gender equality in our projects and in our workplaces, and to prevent and respond to gender-based violence. So as I conclude, I do want to reiterate that USAID is committed to continuing to work together with Tanzania to address the dual problems of GBV and violence against children. Can't say it enough how important it is. So for all of you there, we're here for you.